Hey everybody, welcome back to, yes, it's Sunday night again. Welcome to Bite-Sized Learning. I'm your host, Dr. Mike Sevilla, OAFP President, just for a few more months. And I know, before you click off, because I know you're not here to see me tonight, we have some great guests coming up. We have a great topic, very timely topic, so just hang on. Just a few announcements having to do with OAFP stuff. So we still have room for our virtual KSA for palliative care coming up on Sunday, February 21st at 5:30 p.m. Registration ends February 15th. Hopefully you'll still have time to register, and hopefully there's still room for you to register. So secondly, if you haven't checked out our Racial Equity Book Club, very popular with members this year. Our next edition is coming up on Tuesday, March 2nd at 7:30 p.m. Our moderator is Dr. Wayne Ford, and the book is The Political Determinants of Health by Daniel E. Dawes. You can get more information at ohioafp.org, and then you can register there. And we have already talked about adding to the book club coming up in the next few months because it's been so popular. So thank you out there, members and people interested, for taking part in that. And final announcement, if you didn't all know already, we have merch. That's what the cool kids call it. But OAFP merchandise, the proceeds go to the OAFP Foundation. And we have some new stuff. If you haven't checked it out in a while, we have a COVID vaccine mask with a check mark saying you got the vaccine. We have a few new shirts and a sweatshirt saying proud to be a vaccinated OAFP family physician. So I've ordered mine. I should be getting them this week. I should be taking my selfies with them. And of course, it's for a good cause, the OAFP Foundation. So check out all of those items at ohioafp.org. So before we bring our guests in, I do want to just give a quick sentence of introduction. We're going to be talking about, COVID vaccine. Who is not talking about COVID vaccine, especially if you're in healthcare. And we're going to be talking about an education/advocacy campaign called This Is Our Shot. I'll let our guests kind of describe that, but I'm very excited about that. I've been seeing that all over the internet. So our guest coming up, Dr. McDonald, Dr. Alex McDonald is a family medicine and sports medicine certified family physician at Kaiser Permanente in Fontana, California. He's very active in social media and helped us start the This Is Our Shot campaign. And our other guest is Dr. Mary Krebs. Dr. Krebs. She's the medical director of primary care at Cohere Health, and will provide insight into her experience in vaccine and what Ohioans can expect. We have an Ohio angle as well. So welcome, Dr. McDonald and Dr. Krebs. Thanks for being here tonight.
Hello.
I feel like I should wave. For some reason, I wave far more on these meetings than I ever used to. I never wave when I leave the exam room, but when I sign off a virtual video, I always wave. I don't know why. It's just
that's what it is. I mean, you wave when you come in, and then when we end tonight, we'll be like waving to leave.
Yes, when I leave Zoom, it's always like you wave.
So thanks, guys, we're gonna have a fun conversation. But first, we should do a temperature check. So, Dr. McDonald, you're in California. What is the temperature where you're at right now?
It's a little chilly today. I'm not going to lie. It's like 70 degrees. So a little partially cloudy. I'm sorry. I don't mean to. I'm from Vermont. I spent the first 26 years of my life in winter for like 9 months. So I figure I deserve a little dispensation at this point, right?
Mm-hmm. And Mary, where are you?
It's a balmy 25 degrees.
There you go.
We are expecting 5 to 8 inches of snow tomorrow, and then I think some more later this week.
Cool. So, and shout out to everybody. I tried putting this like in the little This Is Our Shot type of discussion group and try to spread it out. I think there's going to be a great topic tonight. So we're just going to dive right into things. So Alex, so This Is Our Shot. So for people who have no idea what the campaign is about and that, give us a little bit of an intro on what it is and how it came about.
Absolutely. Well, first of all, thanks so much for having me as your guest tonight. It's an honor to visit my fellow Ohioans virtually. So This is our shot. Originated, it was funny. A friend of mine in the young physician section of the California Medical Association, he and I were sort of discussing we should do something about this, starting back in November, surrounding just more COVID and masking and misinformation and disinformation surrounding COVID. And he had done a lot of grassroots activism, actually, and community organizing. I had done a lot of social media work. So we decided to kind of combine our forces and do some digital social media activism. So initially it started with just kind of COVID in general, but then, very early December, we quickly pivoted towards the vaccine, being this is kind of the hot topic right now. And we went through a whole bunch of iterations. My COVID vax, this is my shot. And we really decided on this is our shot. One, because Hamilton is awesome, and we wanted to shout out to Lin-Manuel Miranda, but also this is our shot, our being key word in that whole phrase, right? It's not about you, it's not about me, it's about us. And this is our shot to get back to school, to get back to work, to get back to restaurants and sporting events and whatever it is we missed so much in this past year of COVID lockdowns and pandemics and you name it, right? So that was sort of the impetus of how this all started. It started initially with the young physician section, the medical student, and the resident section in California, and then just quickly exploded. Really, we now at this point, we have over 25,000 people who have used the hashtag on social media. We have 35 major medical organizations from around the country, including the American Academy of Family Physicians, who are partnered with us to help build momentum and build this energy. And really our goal, this organization, is we're not just doctors, we're primarily physicians, but we're nurses, we're pharmacists, we're, you name any kind of healthcare hero. And our mission really is to elevate the voice of healthcare heroes to build trust to get to a COVID-free world, right? That's really our goal. It's not about me. It's not about you. It's not about a physician. It's about your physician. So really, the Kaiser Family Foundation put out some information back in the fall talking about COVID vaccines, and regardless of age, demographic, political preference, you name it, ethnicity, your physician what ranked highest in terms of trust in the mid to high 80s. So really our job, or what we're trying to do within this movement, is basically get a single physician to elevate their voice, to build trust within their community, within their networks, whether that be virtually, whether that be in person, all the above. So we are building to recruit members to our mission. We're working to train them, to educate them surrounding social media, particularly, and how they can expand their reach beyond the four walls of their clinic right now, given that everything is so virtual this year. And then lastly, have them use those skills to build trust, to talk to individuals, to talk to family members, right? It's not about one person standing on TV telling you to get vaccinated. It's about individual conversations and addressing concerns and addressing hesitancy. And really, in family physicians, I feel like are absolutely perfect messengers for this as primary care physicians. We've already built relationships. We've already built trust with our patients. And now we can build on that, right? Because you have to start with that foundation of trust first before you can get anywhere. So that's the short version. I could go on and on, but it's really been really exciting how much it's exploded at this point. And just mind-boggling. I just checked our Twitter stats this morning, and we have like over 250 million impressions just in the past 6 weeks or so that we started this campaign. It's pretty awesome, not gonna lie.
And Mary, let me bring you into the conversation. Maybe share a little bit about where you're at in Ohio, and then give a little bit of your perspective as far as from your patient's perspective, from your community perspective. We hear all of this talk about vaccine hesitancy and all that stuff. Are you seeing that in your community? Are you seeing that in your patients? And how do you respond to that when people or your patients approach you saying, "Yeah, I'm not really sure"?
Sure. I'm Mary Krebs. I'm going to just give a little warning. You might hear a lamb in the background. We have a lamb that is about 2 weeks old, and the mom just wouldn't. She's a bad mom. Let's just say that. And so anyway, so I have a lamb in my bathroom, and she has decided that now is the ideal time to be louder than normal. Of course. So I'm sorry if you guys hear that.
It's family medicine. I mean, that's just what's awesome about family medicine. So
Well, I was going to say we had, when I did the rural health course, and we did the OB part, like we were talking about sheep OB and, anyway. But anyway, to answer your actual question, seen a lot of vaccine hesitancy. I think the issues are, we see it in communities. I've heard a number of physicians talk about it for their staff, which I think is a huge problem because, as you said, people trust their docs a lot and probably the most, but if our staff isn't on board with the vaccine, that's going to undermine the message. So for instance, if the patient comes in to see Dr. Sevilla and the front desk says, yeah, I'm not getting the COVID vaccine, it's too new, then when Dr. Sevilla's like, hey, you should get the COVID vaccine, patients are like, I think it's too new, because they do trust our staff a lot and they see that staff as an extension of us. So we're careful with that. I'm seeing some people who are like, hey, I'm going to knock people out of the way to get it and, call 86 places to find out where I can get my shot the soonest. And then I have some people who are saying it's too new. There's a microchip. It's going to make me so sick. It's just better to take my chances. And a lot of concerns of, oh, I'm breastfeeding. I might get pregnant. I have a history of an allergy to something, so those are a lot of the things I think we're talking about to people and trying to also show that, hey, we're getting the vaccine. And, I wouldn't get the vaccine if I didn't think it was safe and wasn't important. And I'm not going to tell my patients to do something that I wouldn't do myself. So those are kind of a lot of the issues I think we're running into.
Yeah, exactly. So Alex, I mean, it's especially when it comes to the campaign, there is a fine line between, like vaccine advocacy and like vaccine shaming. So how is the campaign trying to balance that effort, to be enthusiastic about people getting the vaccine, but not trying to have this guilt trip thing or shaming thing or not acknowledging patients sometimes valid concerns about the vaccine?
Yeah, that's a really good question and a great point, and something we've tried to think very carefully about. We sort of have this unique time where we can get the vaccine first as physicians and healthcare workers, right? And it's we should, again, let no crisis go to waste, right? So we can kind of capitalize on this moment to lead by example. And not only that, we can also recapture the narrative surrounding vaccines and really prevention in so many different ways. So our goal has always been about staying really positive, right? It's not about shaming. It's not about telling people they should or they shouldn't get it. It's about answering questions. We know based on numbers, and it's a bit of a moving target, there's probably about 20% of the population, as Mary said, who are like kicking and screaming down doors to like get the vaccine as fast as humanly possible. There's 20% who don't want the vaccine no matter what you say or do, and we're probably never going to reach those people. And then there's the 60% in the middle who have questions, right? Who are vaccine hesitant. And that's really our goal, is to reach those people and one, lead by example, because to Mary's point, I never ask my patients to do anything I wouldn't do myself. Stay really positive about this and show positive stories. Be honest about some of the potential risks and side effects, right? Nothing is 100% safe. So we're trying to frame it in the positive. We're trying to provide information and meet people where they are and really address their concerns and questions. Because I'll be honest, I mean, I was vaccine hesitant too, right? Beginning of December, I was like, ooh, okay. I mean, I don't know what's going to happen. But then talking to some experts, talking to some colleagues in my own department, I had my questions answered and then I got my vaccine. And I don't think we should expect anything different from our patients. So I think really kind of using ourselves and using our authentic stories to answer, little small snippets and questions and concerns is really the focus and the effort of our campaign.
And Mary, so we have those patients who really, especially in Ohio, they really want to get the vaccine, but they can't get it. How do you counsel patients on how to, try to get access to the vaccine? I mean, I have this too, where I have a lot of, especially Medicare and older people, can't use a computer. You need a computer to register for some of this stuff. How do you approach that with some of your patients?
I think a lot of it is, we try to know where the vaccine availability is in our community. And also trying to get them to partner with people who might be a little bit more tech savvy. So if you've got a patient who's 70 and they like a computer is just like this crazy box to them. I'm not going to convince them how to be on the computer, but hey, your daughter who always comes to your appointments, she really seems to care about you. Could she help get you signed up? So I think leveraging family and friends to do that, I think is really important. And I think also what I kind of think of is I also look at what's going on with the patient. So, if I have a healthy 25-year-old who's like, I want the vaccine, the conversation is more like, that's great. And I think you should get the vaccine when it's your turn. But we've got a lot of people, unfortunately, who are a lot higher risk than you are. And we need to let them first, but I hold your horses and I want you to get it. I really do. I'm excited for you to get it. But then, and then we also, here in Ohio, I think they did it as good of a job. You can never put a perfect priority on things. It's just not possible because we all know, we all have that patient who really is high risk for COVID, but they're not 65. Maybe they're 63 and they've got asthma, but they're not technically going to get it anytime soon, but that they should, and so you kind of, tell them what I've been telling them is look for opportunities where it's going to be wasted. If you're a 63-year-old with severe asthma, who's not quite, in that category, hey, call Walgreens every day, call CVS and see if anybody no-showed for the vaccine and they have some that's going to go to waste. Because I think we've got to balance that line of, we want to get the high risk people vaccinated first, but we also don't want to let any vaccine go to waste. And so it's kind of that balance. And I think that's tricky, but that's kind of how I think we can talk to people about it. But I think with the patients who are have challenges technology wise, telling them how to call, seeing if we can get their family and friends helping them, is the way to go.
Now, Alex, let me ask you about the campaign. So I know it kind of started with, physicians and medical professionals, and I would guess that there's going to be, a targeting to the general public. So if somebody in the general public, wants to, be a part of it or wants to show their support for the campaign, how can they do that? Is there a website or can they take selfies? What's the hashtag? All that type of stuff.
Absolutely. Really, and again, this is, doing a social media campaign and effort. We can't just target physicians, obviously. I mean, that's primarily healthcare workers is our main target right now, but obviously spillover into the general public is going to happen. And at some point it will hopefully be the main target once the vaccine is more widely available. So the hashtag, this is our shot. We have at this is our shot handles on Twitter and Instagram. And then we also have a Facebook page, which we have a public Facebook page where anyone can go and leave comments and give information. And then we also have a private Facebook group, right? Particularly for maybe OAFP members who want to get more involved. It's a private group. We have to kind of request access. And that's more for kind of organizing and allies of the movement themselves too. Not just healthcare workers, but people that are really passionate about it too. And lastly, we have sort of a placeholder website right now. This is our shot.us, where you can go sign up. We actually have a full website launching, knock on wood, tomorrow or Tuesday, actually.
Breaking news! Breaking news on this show.
Yeah, exactly. A lot more information there too, and some toolkits, and we have graphics and things like that people can like and share. So the bottom line is, if you want to help this movement, just get on social media with your nearest device and use the hashtag. This is our shot. That's probably the best way to help spread the message. Great.
And Mary, and we talk about this at meetings all the time. I mean, it's, of course, there's more than social media. I mean, a lot of it is word of mouth, and what are you seeing, or what suggestions do you have, like from the grassroots, really grassroots, like from rural Ohio or rural America, on how we can be advocates in our communities for the vaccine?
I think it's talking to people wherever you can. I think like the merchandise is a great conversation starter. People might see that and say something to you, and that's an opportunity to educate. Recently we had our Wi-Fi was having issues, and the guy for the cable and Wi-Fi guy came in, and somehow we ended up in a conversation about COVID vaccines and how he should get his vaccine when it's his turn. So I think it's just looking anytime you're, talking to anybody, we're all talking about COVID. I mean, COVID, how can you not have a conversation about COVID? And I think that's a very natural pivot to the vaccine. When people are saying, oh, I am so frustrated that I can't get to see this, or this is canceled, or I really want to go out to eat again, or whatever it is, then that's a chance for you to say, yeah, I hear you. That stinks. I got my vaccine so we can to try to get back to normal sooner. And that might open up some questions. And like Dr. McDonald said, it's totally reasonable to have questions. I mean, I think sharing that with patients instead of I've always been like, I'm going to get the vaccine the second it comes out. I had some hesitancy, that this did come out really quick, and that's a totally reasonable thing to think about. But then and if I'm thinking that, my patients probably are thinking that. But what I have done, similar to Dr. McDonald, I looked at, I talked to experts, I read up on research and realized it's not that they did it really quicker. They took a mechanism that they've been already working on for other diseases, said, oh my gosh, COVID's a little bit more pressing than Ebola right now. Let's focus on that. Took what they already had on other vaccines, used it. And then they also had all the smartest people in the world all working on this. Normally, they have a few people working on this vaccine and a few people working on this vaccine. But right now, probably almost everybody in the vaccine world is working on COVID vaccines. And so, more people working more hours or, nonstop collaborating. And also, they didn't skip any steps. They just made it more efficient. And it was a kind of eye-opening that, wow, the vaccine process they really kind of stretch it out normally and have it, and it's not the most efficient. And, Dr. Vanderhoff, spoke to the OAFP board and was discussing how they didn't skip any steps. They just did some of the steps quick, at the same time, which is a very big difference. And so that really helped me deal with the issues of, wow, it is quick. It is quick. But isn't it a miracle that they can do that? And when you put millions or billions or a ton of money and all of the smartest people in the world on something, it's amazing what can happen.
Exactly. So Mary,
I'm nodding my head very enthusiastically.
You did a great CME for AFP about COVID vaccines, and the question I have for you is, I have a lot of patients. You probably have a lot of patients too, Alex. I have a lot of patients say, hey, I'm waiting for the one-shot one. I don't want the two-shot one. I'm waiting for the one-shot one. Mary, so when patients ask you about that or have questions about this other vaccine or any other vaccines coming out, what do you tell them about getting the vaccine?
My explanation, what I've been saying is, hey, we've got one that is 95, 94, 92, or two that are 94, 95%. And I tell them what every doctor I know has said is take whichever one you can get first. Basically, think about we're in an ocean, we're all swimming in it, we're all kind of drowning. And I'm not going to be picky about what my life preserver looks like. You throw me a red one, I'll take the red one. You throw me a blue one, I'll take the blue one. So if that's the first one you can get it. But if you can get a Moderna or a Pfizer, whichever one you get, have the option of first, you grab that life jacket or life preserver.
Cool. So Alex, I cut you off before. I thought you were going to say something. I
was talking about how my neck is going to fall off from nodding enthusiastically after Dr. Krebs is dropping truth bombs all over the place here. I could not agree more.
Our time is going on very quickly, and I told myself I would limit this to 30 minutes because we could probably talk for hours. So as we start to kind of wind things down, I'd like each of you just to kind of maybe some closing thoughts for our audience, especially Alex, if I forgot anything about the This Is Our Shot campaign, and Mary, I'll come to you for some closing thoughts too. So Alex, as we're closing up our conversation, what did I forget about the This Is Our Shot campaign, or what do you want our audience to kind of take away from our conversation as we start to close up our conversation?
I mean, I think the biggest thing is really to engage in conversations and really address people with where they are, right? To Dr. Krebs' point before, when a patient comes in and really wants the vaccine, you counsel them very differently than someone who's very resistant to getting the vaccine or someone who just has questions. So I think the biggest thing is you meet people where they are, right? You ask those questions, just like any counseling we do as physicians. You sort of meet them where they are. I think that's the most important thing. And then the second thing I think we should really make sure we do as family physicians, especially, is advocate for access to the vaccine. I know there's a lot of primary care clinics which would love to be able to provide the vaccine. They have great infrastructure for vaccinations, but they're not able to get supply. So really making sure we collectively work together to advocate for primary care as a fantastic delivery vehicle for the vaccine. And then lastly, making sure that it's equitably distributed, particularly to our Black, our Brown, our Latinx communities, who we know are disproportionately more affected by COVID for a number of reasons. So it's really important that we advocate as physicians, I think, to make sure that everyone can get the vaccine, has access to the vaccine equally too. That's a really important piece of our campaign, especially here in Southern California. We have some of our colleagues who are doing amazing work where people can literally walk up and fill out a paper, right? You know, a paper thing for a vaccine, they can go and fill out a paper form and walk up, right? Because access bars don't have access to the internet. And so make sure we deliver and we supply the vaccine in a multitude of different ways so that everyone can benefit from this amazing technology.
Cool. So Mary, before I go to you, is the lamb okay?
Lamb is fine. The lamb is spoiled. Okay, like
the lamb okay. I mean,
the lamb is living a good life.
We're getting questions about the lamb, because they'd rather hear about the lamb than any of us. So we want to make sure that the lamb
is just fine. As all of the animals on our farm, they are all quite spoiled.
Does the lamb have a name? It's breaking news.
Well, but Mary has a little lamb. Is that what's going on here? I mean,
there you go.
Well, actually, I was joking because we had to vaccinate the lambs this morning, so I was kind of joking that like it's a little bit like our own vaccine clinic, except you don't have to deal with issues of you do have to deal with issues of vaccine hesitancy, but it's more in the you have to catch the lamb. You don't have to explain to the lamb; you just have to catch the lamb. So.
Wow. All your mail goes to Mary Krebs at OhioAFP.org. So, no, I'm just kidding. Just kidding. It's a joke.
But on topic, I was going to say Dr. McDonald brings up a lot of really good points, and also the issues of disparities. I think we also need to talk to our patients a little bit. Many of our patients of color, have concerns based on how the medical community has dealt with issues in the past. And so I think we also need to be really cognizant of that and listening to their concerns and addressing that piece. Because if we don't address all of the reasons people are concerned about the vaccine, people are not going to feel good about getting it. And so I think a big thing is, hey, what have you heard about the vaccine? And if they're like, hey, give it to me. Oh, great. Our work is done. But other times it's, hey, what have you heard? And then you listen to what they have and you address it the same way we do with so many other issues, in family medicine. So, meet patients where they are, and sometimes you got to go a further journey, and sometimes they're already right there. So.
Awesome. Well, great. Well, thanks both of you for this great conversation. And I guess closing thoughts for me is that, it's just continuing to have a conversation, with your people in the community, with your family physician. I tell people in the community and I tell people on my patients all the time, it's not my job to force this vaccine down you. It's just for me to answer your questions. I understand the hesitancy. It's out there. And if we can continue to have the dialogue rather than having this whole kind of polarizing political thing that this whole COVID thing has turned into, we can try to get back to just some dialogue on that. And I think that's going to be the best way we can try to get through this pandemic, past this pandemic, and all of that. So thanks a lot, everybody. So thanks to our guest, Dr. Alex McDonald, Dr. Mary Krebs. And if you want to hear more of this great conversation or other conversations here at OAFP, just go to OhioAFP.org. We're going to have more great content, great conversations like this coming up in the near future. That's going to be the best way for you to pay attention to all of that. So thanks a lot, everybody. Say bye, everybody. Bye.
Bye, everybody.
Bye.